So, the fifth reason that I'll talk about is vitamin K2 and how it reduces Alzheimer's disease risk by acting upon the cardiovascular system. Now, I previously covered this in my previous video about vitamin K2, but in this video, I'll be reviewing some of those slides and also adding new slides about how it also relates to Alzheimer's disease risk and also how it relates to the study as a whole. So first of all, let's just go over why does vitamin K2 act so differently? And the reason that it acts so differently is because of this extrahepatic activity, which is kind of unique to vitamin K2. Extrahepatic activity means activity outside the liver. So extra outside and hepatic the liver, outside the liver. So let's just kind of look at the cycle that when you take in vitamin K2, how is it absorbed and acts places? So when you consume a food with vitamin K2, it is emulsified by bile salts and then taken up inside the small intestine. The absorption of vitamin K1 and vitamin K2 are different here. As you can see, vitamin K1 has a little higher absorption than vitamin K2 as MK7, MK, and MK9. But the later, they also have the highest extrahepatic bioactivity. And when you factor in both of these, the MK7, MK8, and MK9 have the highest absorption and extrahepatic bioactivity. MK7 is the principal player here and the one that you should pay attention to because it is the form that is the most studied and also the form that is the most easiest to access, given that it's available in nutritional capsules and supplements, and natto, which is the food which is the highest amount in vitamin K2. So after vitamin K1 and vitamin K2, after they're both absorbed, they're acted on by lipoprotein lipase. And vitamin K, vitamin K1 and K2, then enters the liver. And it is here that vitamin K1 and vitamin K2 absorption diverges because vitamin K1 is retained in the liver and rapidly excreted, while vitamin K2 is transported outside the liver by using LDL. So by using LDL, it gets outside the liver and then has extrahepatic activity, this activity outside the liver, and it is able to have effects all over the body. So this is what makes vitamin K2 different than vitamin K1. And so now if we go over the method of action of vitamin K2, I will go over this multiple times just to help learning. So vitamin K in the form of menaquinones, or vitamin K2, it acts upon two principal players. Now, I also talked about GAS6 in my previous video, but for now, let's just look at two players. So the first one is matrix GLA protein, and the second one is osteocalcin. So vitamin K2's most well-known effect is carboxylation. And now osteocalcin, uncarboxylated osteocalcin over here, that's produced by 125 dihydroxyvitamin D3 in the inactive form. So vitamin K2 acts upon these two proteins and it carboxylates them from UCMGP to CMGP and from UCOC to COC. So UCMGP is uncarboxylated matrix GLA protein, and CMGP is carboxylated matrix GLA protein. UCOC is uncarboxylated osteocalcin, and COC is carboxylated osteocalcin. Now, so this carboxylated matrix GLA protein is found on blood in the inside of blood vessels, and it inhibits vascular calcification. Now, this carboxylated osteocalcin is found in bones, and it helps in the promotion of bone mineralization. So, once again, vitamin K2 activates two proteins, matrix GLA protein, from the uncarboxylated state to the carboxylated state, and it also activates osteocalcin from the uncarboxylated state to the carboxylated state. Now, this activated CMGP is found on blood vessels and counteracts vascular calcification and also this age-related wear and tear. This osteocalcin helps to bind calcium in the bones, and activation is controlled by vitamin K2, which carboxylates osteocalcin into the carboxylate form. The uncarboxylated forms are made by 125 dihydroxyvitamin D3, And the carboxylate osteocalcin helps to incorporate calcium into the bone matrix using osteoblasts. So now that I have reviewed this, I will now get back to the study. So, first of all, there are lots of studies that show that arterial calcification and cognitive impairment are linked. So, one study, and this all comes from this paper that I'm reviewing in these videos, so, one study with 844 people shows that calcification is directly proportional to cognitive impairment. So, if you have more arterial calcification, you have more cognitive impairment, and inversely to brain volume. So, if you also have more calcification, more cognitive impairment, and less brain volume. So another study of 2,364 people over 5 years showed that atherosclerotic calcification was associated with increased dementia. And another study of 1,732 people shows an association between atherosclerosis and cognitive impairment. Another study, there are a lot of these studies, shows that carotid artery calcification or aortic stiffness was associated with increased dementia risk. So now, isn't it a possibility that by taking increased amounts of vitamin K2, you can reduce this arterial calcification or carotid calcification and also decrease cognitive impairment? Well, this is an area of research and needs even more research. But let's look at some of the studies that I previously went over. So this is if you watch my prior videos, this was a study that I went over that showed in 4,807 Dutch men and women aged 55 years and over, they compared their intakes of vitamin K1 and vitamin K2 from the lowest intake to the highest intake, and look to see if vitamin K1 or vitamin K2 help to reduce cardiovascular events and coronary heart disease and all-cause mortality. So if you look at the lowest intake and the highest intake of vitamin K1 for number of non-fatal MI episodes, incident new coronary heart disease episodes, coronary heart disease mortality or all-cause mortality, and you can look at these numbers, but they're all pretty non-significant. So just a reminder that basically in science, if anything is less than 5% chance, 0.05, then that's usually significant and it's more than just random chance. So we can take the results with confidence. So vitamin K1 has no effect on these parameters. Now, if we look at vitamin K2, menaquinone, which is vitamin K2, if we look at the number of non-fatal MI episodes, the group that ate the lowest amount of K2 intake, versus the group that ate the highest amount of vitamin K2 intake. They had 51 episodes of non-fatal MI versus 36 episodes of non-fatal MI, and this was non-significant. But if we look at the number of new coronary heart disease episodes, 86 versus 58, and this was statistically significant. So, and then if we look at the mortality, from the lowest vitamin K2 intake to the highest vitamin K2 intake, it was 41 versus 23, which is statistically significant. And then if we look at all-cause mortality, it was 258 for the lowest intake group versus 195 for the highest intake group. And this also was statistically significant. And if we also look at aortic calcification in these 4,473 Dutch men and women aged 55 years and over, and once again, we look at the intake, the lowest intake group versus the highest intake group for moderate calcification and severe calcification events. It's 454 for the lowest intake versus 453 for the highest intake of vitamin K2. And this is it's not very significant. But if we look at the severe calcification events for the lowest intake group versus the highest intake group, it's 960. It's 98 versus 59 events, and this is very statistically significant. So it seems that taking higher vitamin K2 reduces your risk of severe calcification events, and we can hypothesize that this would also, if it reduces severe calcification events, then this would also reduce your Alzheimer's disease risk and cognitive impairment risk, because that is correlated to calcification events. So there was this other study that showed a high menaquinone intake reduces the incidence of coronary heart disease. So for this was vitamin K. This study showed they used data from the Prospect Epic cohort of 16,000 women enrolled between 1993 and 1997, between 49 and 70 years, who were free of cardiovascular disease at baseline. And these vitamin K and other nutrients were estimated with a nutrient frequency questionnaire. Now, a nutrient frequency questionnaire is not the best method, but after you take this together with all the other studies and with the high sample size, you have more confidence in the results. And this, since this is followed up with other studies, we have more confidence that this is the method of action of vitamin K2. So then they followed up these people for eight years around, and found 480 new cases of coronary heart disease. And they found that vitamin K1 intake was this amount, 211 micrograms, and vitamin K2 intake was 29. And after they adjusted for risk factors and dietary factors, they found an inverse correlation between vitamin K2 and the risk of coronary heart disease. So if you eat, the more vitamin K2 that you take, the lower that your coronary heart disease. And this had a hazard ratio of 0.91. And this association was mainly due to the vitamin K2 subtypes MK7, MK8, and MK9. So remember that those are also the subtypes that have the highest absorption and also the highest extrahepatic activity. Now, is this an interesting just coincidence, or is this actually the mechanism by which they work? So now also I'll go over another cardiovascular trial. So this was 243 subjects, 40, 70 years old, with a UCMGP level that higher than the median of the general population. And they were given 180 mcg vitamin K2 as MK7 daily for 1 year. And they were compared their baseline characteristics and a placebo group pre and post 1 year. And they were trying to see if this exerted positive favorable effects on vascular characteristics, which is the carotid femoral pulse wave velocity. Now, let me just go over what this carotid femoral pulse wave velocity is. It's really the gold standard of aortic stiffness, and using this uses ECG gating and wave reflection and other techniques to come up with a value representing aortic stiffness. So now if you look at these people that were in the placebo group and the MK7 group, so over the follow-up duration, there was a change in the carotid femoral pulse wave velocity. So it increased, which means that basically they became more stiff. Which is just something that you expect over as the participants aged, and this was normal. But in the MK7 group, this wasn't statistically significant. So MK7 helped to prevent this aortic stiffness from happening. And if you remember, in the population studies, aortic stiffness is also correlated with Alzheimer's disease. So if your aortic stiffness actually goes down, then your Alzheimer's disease risk also goes down. And then this helps you preserve your cognitive functioning. Now, this is all very interesting, but it requires more research. And we need some direct studies that perhaps over a long duration, see if taking vitamin K2 helps to prevent cognitive disease. Because while there are interesting hypotheses, we don't really have any direct research answering the problem. But this is a very interesting research area nonetheless.